So one of the questions I also am frequently asked is, if these drugs like the Aricept, the Exelon, the Razodine, and the Namenda don't cure Alzheimer's disease, what do they do? And I like to tell people in the beginning, right up front, if you will, that it's best not to think of these drugs as memory drugs. In fact, I tell medical groups that I speak to that. And if they improve memory, that's great, but that may not be the most beneficial effect of these medications. One of the primary areas of improvement with the Aricept, Exelon, Razodine type of drugs is a reduction in apathy, and that's a very positive effect. And if you look at the drug studies and the way we test and monitor for this, usually in the treatment scores, reduction in apathy is very high. They also, I think you'll find that very often, and usually the benefit takes some time to take effect. So these drugs do not work right away. In fact, if you look at the studies, it takes up to 12 weeks to see the full effect. So don't expect that something's going to happen tomorrow. It may happen in the first week, and that's great. But in fact, it will take time. And a reduction in apathy, more interaction, more sociability, interacting with others around them, more engaged in their environment, being able to help out with some activities of daily living that they weren't able to help with or do before, being able to assist in getting to the toilet where before they required total assistance in toileting, helping out at the dinner table or even helping do the dishes. So those are things to watch for. It's the little things. And these are very important areas that for you to monitor as you see your loved one and report to your physicians, because physicians may or may not ask, some of those questions. So the other area that's very important, and the evidence certainly points to this, most of the evidence anyway, in research and also clinical trials, as drugs of this type help to reduce, and that's true for both classes of drugs, later on, some of the behavior problems that we see with these conditions. So behavioral problems are like increased anxiety usually is there in the beginning, but later on there are problems like paranoia, believing someone is stealing from you, sometimes hallucinations, but that's usually late in the disease, in Alzheimer's disease. Agitation, irritability, there are lots, sometimes striking, hitting out, that's usually in the more moderate stages of the disease and depends on the individual. But there are a number of what's called psychiatric behavioral conditions associated with Alzheimer's disease, and these medications in both classes reduce the need for medications to treat these behaviors. And that's very important for a couple of reasons. One, it's easier to care for someone that doesn't have these behaviors, both in the home and if it's a facility like a nursing home. And also the fewer medications that anyone has to take, the less likely there's a drug problem, like a drug interaction or an adverse drug reaction. So my approach is with medications is only drugs that absolutely need to be there. So I'm a believer if a medication is going to be used, we use it at the full dose and we treat with a full treatment. But if a medication no longer needs to be there and this patient can do without it, then we should stop the medication. So maybe one of the questions to ask the next time you see your physician or go with your loved one to see the physician is, do all these medications still need to be in the medication list? And I suggest that everyone take with them a full medication history when you go to see the physician. That includes not only prescription drugs, but non-prescription drugs, social drugs such as alcohol and nicotine. Alcohol interacts with a lot of medications. Nicotine not only interacts but can affect how some drugs go through the body, affecting enzymes in the liver. And also especially important are the alternative or herbal products or non-traditional forms of treatment.